Okay, hey guys. So I'm gonna go through the Kahoot with you, and I just started it up, waiting for players. It says I should make sure that you guys can hear what I'm doing. I think so. Yeah, you can hear. All right, so I'm gonna play on my phone because this is the one I'm playing here. Your guys is when you do it at home will be different. It won't be the same one because you'll have to start your own game, and then you'll have to start your own game and then use your own game pen. So here I am ready to go. Let's start the game. I'm just playing along so it will actually play for you. We'll go through all of this. This is your ischemia and infarctions Unit 3 review, and you guys can play along kind of in your head. Okay, if a patient shows definite signs of ST elevation, where did they go next? So you have to think about what ST elevation means, okay? So where do they go if they have ST elevation? Okay, so the correct answer is to the cath lab. So if they have ST elevation in your brain, you have to remember what ST elevation means. That means they're having a STEMI, so they're having an active heart attack. We do not put them under a stress test. We don't go for further testing. They do not go home. They go to the cath lab to see if they can place a stent. That's the correct answer for that one. Okay? All right, next question. Hey, look, I'm in ahead. Here we go. What abnormality is seen in the following EKG? So we're going to see what this EKG looks like. Okay, what's that abnormality? See if you can see what that is. Okay, that is a peak T. Let's go ahead and take a look at that. You can see the really tall T's here. And how do you tell? Some of you have these confused with the QRSs. This is a P, QRS, tall T. This is a peak T wave. Peak T means it's tall and peaked like a tent, and it should be at least 2 boxes high. This one is almost exactly 2 boxes high. PQRST, PQRST. And you gotta remember what peak T stand for. It can be lots of different things, right? We just need to know their age and symptoms and any other tests that we might be able to do to figure out what's going on. Next question. What does a large or a tall QRS represent on an EKG? So a tall QRS, really big ones, almost off the paper. And if you've done Manny's EKG, you've seen how tall his is. So that stands for left ventricular hypertrophy, or LVH. This is it's good in young males. That means that their heart is strong. And it's also good in athletes, also good in little kids. You'll see really tall QRSs. Now we've talked about it seeing tall QRS complexes in older people. That's the bad kind. That's chronic high blood pressure. So if it's an older person, it's not so good. And a younger person, it's perfectly normal, especially in young males. What is the definition of ischemia? And I am not answering these right away so that you guys can think about it for a second so it doesn't stop the game. All ischemia means is that it's a narrowing of the blood pressure of the blood vessels. Okay, it's active chest pain is angina or angina. Muscle atrophy is the shrinking of muscles, and asystole actually stands for when the heart stops beating. We have no more electrical conduction going to the heart. That's what asystole stands for. A means the absence of. Systole refers to the systolic blood pressure. So if you have the absence of systolic blood pressure, it's not beating. Okay, that's what that means. So ischemia is a narrowing of the blood vessels. Myocardial infarction literally means what? Since it's myocardial, it's heart muscle, and an infarction means death. So this is heart tissue, and this is death. So this means death of heart tissue. What represents an old MI on an EKG? So an old heart attack. What does that, how do we know they've had an old MI on an EKG? What will we see? A difference? Is this different than a recent one or an AMI or a STEMI? It's going to be that pathological cue. I explained these in one of the videos I did for you guys that it's a little bit deeper and a little bit wider, that Q wave, than a normal one. It's very subtle. You don't see it jump out at you. I am not concerned with you finding pathological cues on the exam. Okay. So just need to know what it stands for. Just that a deeper, wider Q wave means a pathological cue. They had their heart attack a long time ago, several months to several years ago, and it permanently scars your heart. Okay. Next question. What is the name of the enzyme your heart emits when the muscle has had damage? It's one of those enzymes we're going to check for in their blood for heart damage. Did you choose troponin? Because troponin is correct. Troponins are letting us know when the heart has had some sort of damage. And it doesn't have to be a heart attack, it can be just a blow to the chest, even. Okay. Every time you have damage to the heart, it's going to emit this enzyme called troponins. And normally ours is almost zero, but once it's had some damage, it'll be high. What type of patient has LVH? Talked about that a few minutes ago. So when we talked about it earlier, I did mention that athletes have it, young children have them, and so do people with chronic high blood pressure. So this correct answer is all of the above. What can represent ischemia on an EKG? So what can represent? If you remember, ischemia, there's a lot of things that mean ischemia, if you remember. Typically, all of the above. ST depression, inverted T's, and peak T's can all mean ischemia. Okay. And we won't know until we run troponins and or a stress test. If the troponins are negative and they're okay, they're low, we can run a stress test. We'd find out if it's truly ischemia. Okay, if the T wave becomes inverted during a stress test, what does that indicate? That means if it wasn't inverted before, but once they go into a stress test, now it is, what does that mean? That actually means it's ischemia. Inverted T's can only mean two things, either ischemia or a recent MI. If it's a normal T wave before a stress test and it becomes inverted during a stress test, that is a sure sign of ischemia. If you hook them up to the EKG in rest and they're laying on the bed and they have these really deeply inverted T's without doing any stress, just laying there still, it could most likely be a recent MI. If you find only one T wave inversion, what does that indicate? I think all of you know this one. This is non-diagnostic, right? Yeah. You only find one, no big deal, non-diagnostic. That's your normal. Okay, what does STEMI stand for? What does that acronym stand for? So each of the letters stands for something. That is ST, elevation myocardial infarction. That's STEMI, STEMI. That's what STEMI stands for. It's telling you the ST segment is elevated above the isoelectric line. And that stands for heart attack. Okay, which leads represent the anterior region of the heart? Which ones are the anterior? If you remember, anterior means front. So wherever our stickers are that are placed right on the front of the heart, that's the right answer. It's V1, 2, 3, and 4. I may on the chart on the test may ask you for which ones are on the right of the septum and which ones are on the left of the septum. And anatomically, it makes sense that V1 and 2 would be on the right side of the heart, so on the right side of the septum. They're still anterior, just right septum. And 3 and 4 would be on the left side of the septum, anterior. Okay. But they're all considered anterior. Okay, what can peak T's in an adult mean? Peaked T's. We learned that peak T's can mean a lot of things, didn't we? In this situation, this answer is all of the above. It can mean ischemia, it can mean hyperkalemia, it can also mean an AMI. We don't know anything about this until we know what their age is, what their symptoms are, why we're doing the test, and then we're going to have to pull more tests. We're going to have to pull troponins, we'll pull potassium, and we'll see where if we fall in those normal ranges or not. We need to know if they have any history with that would cause them to have hyperkalemia, like dialysis or a renal patient, renal failure, that sort of thing. Okay, if peak T's are present in a teen's EKG, what can that mean? Teenager's EKG. I bet some of you are going to choose one over the other. There's only one correct or the best answer. Choose your best answer. Actually, a normal variant. Okay. I know I have said that peak T's in teens sometimes mean that he's an athlete, but in general, it's normal. It's a normal variant or considered a normal variant when there are peak T's in a teenager's EKG, especially a male teenager. It sometimes means they're an athlete. It just sometimes means they have a strong heart. So it's normal for them. That's the best answer. Okay, what is prevalent in this EKG? Do you see it here? That is T-wave inversion. Let's take a look. T-wave inversion in V1, 2, 3, and 4. And the more deeply inverted it is, the more recent the MI typically. Deep ones like this usually mean they had like an MI like on Saturday. Yeah. A couple days later, they come to get checked out. Okay, what types of tests would you run on a patient with peaked T's? So that patient has peaked tall T's. What type of test would you run? Peaked T's mean a lot of things, right? But one thing they can mean is that high potassium, that hyperkalemia. You always want to check potassium when you see a peaked T. And you always want to check for troponins because it could mean they're having an MI. So we want to make sure we're checking those two first, potassium and troponin levels. Unless you assume it's a normal variant, obviously. Okay, what two things are most important when diagnosing an EKG? I asked this exact question on the test. What two things are most important when diagnosing or interpreting an EKG? Age and symptoms, or age and the reason for doing the EKG. Age plays a big factor. We know that kids' EKGs look very different than adults. Teenagers look very different than adults. And then any type of symptoms they might be having. If this is just a normal, regular checkup for a teenager, it's going to be way different than if it was a 57-year-old having chest pain. So you have to know both of those things. That is a question on the test. What medication shows up as a scooping on an EKG? So this is the medication. What's the medication called? That medication is called digoxin. The scooping phenomenon is called digitalis. Don't get them mixed up. Digoxin's the medication, digitalis is the scooping phenomenon. Okay, peak T's and inverted T's are blank if accompanied by symptoms. Kind of a trick question. It's really just abnormal. If they're abnormal, you have peak T's and inverted T's and you have symptoms with those, it's most likely abnormal. We don't know what it is because it means lots of different things. So we have no idea what it is. We know it's abnormal. That's the best answer for this. Hey, if 67-year-old patient wasn't feeling well during dialysis, that should give you a nice clue. What could be the diagnosis? And if you're anything like me, you probably could see those jumping off the page there. in V2, 3, 4, a little bit in 5. Tall peaked T's, and they are a dialysis patient. That's going to be most likely hyperkalemia. So anyone with dialysis, kidney failure, would probably have high potassium levels. So we're going to check on their potassium levels. We'll also check for their troponin levels, but the first thing we want to check is their potassium because they are a renal patient. Okay, what does this picture represent? This is the exact same picture on the test, by the way. I'll give you the answers now. Okay, those are the 3 different types of depression. So you have this picture on your test, and you need to tell me which one's which. This one is horizontal, as the ST segment is horizontal. It's well below the isoelectric line, and it's down here, and it's flat. This is called a downsloping because it comes down here below the isoelectric line and goes down first before it comes back up. And then this is upsloping. We have a QRS. It starts way down here and upslopes into the T wave. So horizontal, downslope, upslope.